Hi, everyone. We'll just give it maybe another minute, Jared, if that's okay, to let everybody sort of settle in. No worries. We recognize it's lunchtime, so everybody has to mind their eyes and noses, as we would say on the hospital side. All right, great. It is 12:40, so I want to be respectful of everybody's time. I'm Emma Steinberg. I am a graduate or an alum of the fellowship program. I was part of the third cohort, I think, from 2019 to 2021. I currently work as a pediatric hospitalist, and it is an honor and a privilege to also be a board member of Nourish, California. So exciting to be here with Jared. I'm going to give Jared's intro, and then I'm going to hand it over to him to share some more information about Nourish, California, and then hopefully we'll have about 10 or 15 minutes for a discussion and some question and answers. So we are super privileged today to have Jared Call, who is a senior advocate at Nourish, California, formerly California Food Policy Advocate. He joined Nourish, California in 2015, and he oversees the organization's state legislative agenda, as well as their annual policy development process related to California state legislation. Jared leads Nourish California's advocacy aimed at increasing low-income Californians' access to and participation in CalFresh. Call out to SB 107, if I'm getting that one right, from Senator Wiener. Jared's area of focus have included ensuring an equitable customer experience across the state, linking CalFresh access to other state public benefit programs, as well as simplifying the application process. Again, another call out for SB 107, particularly for older adults and people with disabilities. Jared also leads Nourish California's work to successfully implement state funding and for a nutrition benefit pilot project. So thanks so much for being here today. We are thrilled to have you and can't wait to hear a little bit more about your work and Nourish California's work.
Thanks, Emma, and thanks everybody for joining us here today. Really appreciate the opportunity. Emma, you're really bringing the theme with the outfit today. I should have had my suit on maybe as my lobbyist gear, but yeah, thanks everybody. I'm Jared. I'm with Nourish California. As Emma said, I lead our state legislative agenda. So I am technically a registered lobbyist, but my constituency is low-income Californians that lack sufficient access to healthy and affordable food. That is sort of a summary of our mission statement. As Emma said, we are newly rebranded as Nourish California. For 20 some odd years, we were California Food Policy Advocates. But our mission is the same. We're the same people. We have different email addresses, and we're not a fork. Now we're a bear. That's pretty much the only difference. And so, yeah, we are a statewide policy advocacy organization. We do sponsor legislation in Sacramento. We also do work on advocacy at the federal level, though we don't sponsor legislation at that level. And we really organize our work around the federal nutrition programs, primarily leveraging those, ensuring that people have full and equitable access and participation in those programs, like CalFresh, like the school meal programs, the child care nutrition programs, and WIC. And so we seek to leverage those and find opportunities to improve how they work in California. And we organize our work through 4 agendas that we work to inform throughout the year, and then we release at different points in the year, depending on sort of the cycle that those are on. But those are first the state legislative agenda. That one does have a very hard date in terms of calendar because it's linked to the state legislative cycle. We can share that if people are interested, but I'll spend a lot of time actually talking about that agenda today. And that's where we really seek to create change at the state level by changing state law. And then we have, as I said, our federal agenda. We engage in with our California congressional delegation, particularly around large pieces of legislation like the Farm Bill, where the SNAP program is reauthorized, and what's coming up soon is child nutrition reauthorization, where those school meal programs and the child and adult care food program will be reauthorized. And we could do things not just on access and participation, but make the programs work better for administrators and kids alike, as well as make sure that they have robust and science-based nutrition standards. I think we've seen over the past 4 years sort of the weathering down of some of those standards that were put in place in the previous administration. I think we're anxious to make sure that those reflect the science about what goes into a nutritious meal for a kid in school. So that's our federal agenda. And then we do sponsor that state legislation. And once it does pass and we get a signature from the governor, that's great. That's a time to celebrate. But then those policies need to be implemented by the administrators, the Department of Social Services, or maybe the Department of Education. And so that's when our state administrative agenda comes into play, where we need to push administrators to really fulfill the vision, sometimes not just the letter of that legislation, and just generally push them to do more than they otherwise would do. Administrators tend to be risk averse. They want to keep the trains running on time, and that's about it. But there are things that they can do that are in their purview to make programs work better for clients. And so that's where our state administrative advocacy comes into play. And then sometimes in our policy development process, we go out and we listen to people, conduct key informant interviews, we do surveys and focus groups to find out, mostly from primarily low-income Californians, but also providers and service providers like yourselves. What's not working? What are the barriers keeping people from having access to sufficient affordable food? And what ideas do people have about potential solutions? And sometimes in that process, there's a sort of a clear path forward, and we craft a policy proposal that will end up on the state legislative agenda, or we realize, there's a regulation that's holding something back, and could we get the administrators to have a different interpretation or issue more helpful guidance to local administrators on how to carry out a program. But sometimes we really don't know the answer. We realize we need to learn more to be able to craft an effective policy solution, and that's where our research agenda comes into play. So those are for those issues and problems that we don't necessarily have the answer for yet, but we realize there's something there, there's a problem that needs to be solved, and we need to conduct some research on our own or partnering with another research partner to learn out what the policy levers are that we can hit to help solve that problem. Maybe I'll stop there. Is there more that I should go into on that? That's sort of how we organize our work. Just sort of the basics. We are a pretty small organization. We're 8 people, and I cover the whole state. We have offices in the Bay Area. That's where I'm located. I would be spending more time in Sacramento if this were a different situation, at the Capitol and in some of those administrative offices. So we have our Bay Area office, we have an office in LA, and then we also have a small office in San Diego.
Awesome. Thanks so much, Jared. I think that really helps the fellows understand that there are a lot of different ways to advocate for policy, both on the state and federal level, and that research and focus groups really help inform a lot of the work that you all are doing. And I think for me as a fellow, learning about a lot of that administrative side and that administrative advocacy was huge, and was an area that I knew very little about before doing this. Great. So if there aren't any sort of burning questions, I did get a chance to review the questions that you all submitted prior to this session. Jared, I was hoping we could dive in. Are you good to transition to the Q&A?
Let's do it.
Okay, awesome. So I wanted to start with if you'd be willing to share how Nourish California's work has been affected by COVID-19, and specifically if there have been any lessons that you have learned about food security policy during COVID-19 and in anticipation of some of the potential rollbacks or changes after the pandemic is over.
Sure. I mean, I think, so here we are at about the 1-year anniversary of when we as an organization shut it down, and I walked into my boss's office in Oakland and he said, go home and stay home, for 2 weeks, maybe 3 weeks. And here we are a year later. So a lot has changed. I think the most stark thing for us, and we actually just put up a post this morning, a sort of a 1-year anniversary, detailing all that we've been doing over the past year. So maybe I can share that later, or we can share it out after the meeting. But hunger and food insecurity really has been having a moment over the past year, sadly. We saw the rates of food insecurity spike early, and they have unfortunately been sustained despite a lot of federal and state action to try to address the problem. They're generally about double what they were pre-pandemic, and particularly for Black and Latinx households. I was just checking the Household Pulse survey that Northwestern University puts out. It's a weekly survey. And I was really struck by, in particular, Hispanic Latino households with children. The rates of food insecurity were around 38% of all California households. And that's shocking. And that's despite the great federal action and the great work that the state has done, and the Emergency Food Network and schools. So we've been busy. We sprung into action right away, realizing there was a need, first and foremost, to educate policymakers about the scale and scope of the problem and the urgency of the problem. So we seized on things like the Household Pulse survey and made sure that policymakers were aware of the problem and that it wasn't going to get better without real action. So then we also advocated at the federal and state level for some of those important changes. And it did take a while. The previous administration and Congress did not act swiftly. I think eventually we did get some of those changes. From the first weeks, we were calling for an across-the-board increase in SNAP benefits, recognizing that was one of the most effective interventions during the last recession. And we had a really strong argument for all the decision makers. We thought that obviously it's a powerful public health intervention and proven to decrease food insecurity and improve health outcomes, but also as an economic stimulus. So we really thought we had a winning argument. And it took until just a few months ago to get that change finally done. But there were other quicker, more successful things, like the pandemic EBT program. If people with that was what provided families who have kids in K through 12 school who qualify for free or reduced price lunch, who were then missing out on those meals, even though eventually we got some waivers from the federal government to allow schools to serve meals in that grab and go style to anybody who showed up. That took a while and took a while to operationalize, obviously with schools having so much going on. But the better idea was to just send those families an EBT card loaded with benefits, food benefits that equate to the value of those lost meals. And we really do applaud the state for how quickly and comprehensively they stood up that program with literally zero administrative funding from the feds. They served 96%, I think, was the uptake of qualifying families, and got, I don't have the number in front of me, but billions of dollars of food benefits out the door in a matter of weeks. And now we're gearing up to do another round of that. So there was education, advocacy, and then translation and communication to our partners. We do some interaction with grassroots organizations to let them reach the people on the ground. They're sometimes the more effective messengers. We can help sort of translate policy into regular language. But we need to partner with those trusted messengers to get the information to the actual clients. So we worked with Code for America, who's done some great work on CalFresh access, to develop a really simple application for those families who qualify for pandemic EBT, but for whatever reason, their data isn't quite right in the system. So they weren't automatically identified as being eligible. And it was just a really quick, like 3-question online form that was really a major part of that success. And so we've tracked and advocated and communicated, and we're also trying to learn how these flexibilities that have happened to ease CalFresh access, some of the hurdles that they put in front of applicants to get through that application and enrollment process have been temporarily suspended. And so we're tracking those outcomes to make the case after those waivers expire, or maybe even before those waivers expire, that some of those should be made permanent. It wasn't a situation where, this boogeyman of fraud or abuse of the programs hasn't happened. And so why are we putting these burdens in front of people who are applying for food assistance and probably are not having their best day if they're applying for food assistance? And let's meet clients where they are instead of putting that burden on them. And also the pandemic EBT program, that's actually built on a proven model called summer EBT that provided benefits during out of school time during summer when those families need a little extra help putting food on the table. Let's bring summer EBT to California on a permanent basis. That was something that was piloted in other states, and we'd been pushing the state to do for a number of years and had been on the cusp of being one of those pilot states. And now out of nowhere, we have the proof of concept for a lot of things that if you'd asked pre-pandemic, asked administrators or decision makers, could we do this? It wouldn't have even been considered. No, there's no way we could ever do that. And now we have this literal proof of concept for a lot of these helpful policies that can help a lot of people. Maybe I'll stop there. I could talk, we've done a lot over the past year. Maybe I'll share the post and people, when they have a little time, can go through a lot of what we've done.
Yeah, I think that would be great. I just saw the email from George also, so I think it would be really helpful to share that. And Jared, I really appreciate you talking about not only the scope of the different interventions, but also the fact that you were calling out the disparities that exist. These disparities existed before the COVID-19 pandemic and have only gotten worse. And especially, like you said, in households that have children too. And so I just want to acknowledge a couple things in the chat, but then want to use that as a transition to talk a little bit about health equity. So just want to acknowledge one of the comments. I totally agree. It is incredibly sad that it took a pandemic for the environment and society to recognize the value of federal food programs. And then another comment about how it's been really challenging to think about the access to sort of higher quality foods and having to sort of make choices and choose lower quality foods to be able to stretch the budget, but also thinking about like what's shelf stable. So when people have sort of limited access to certain types of foods or beverages, or when there was concern initially about you know, whether or not people were going to be able to even have access to a store for quite some time, what types of foods they needed to purchase in order to be able to make sure that their families had some sort of nutrition, and unfortunately then the impact that that has on health. So thank you for those comments. Please feel free to keep putting things in the chat and asking questions. Jared, I want to go back to this issue of equity and the health disparities that you were alluding to within our state. I'm wondering if you can talk about what Nourish California has been doing to call out and address the health equity issue, especially around food insecurity and hunger, and how it's come up in some of the policy and administrative conversations, especially around the simplification of applications, like you said, or helping to identify people who otherwise would have been sort of filtered out and fallen through the cracks.
Sure. I think we're doing some good work as an organization, both internally and externally, to center equity, diversity, and inclusion in our work. But we recognize that that work for us is really just at the starting point. I mean, we have a statement in our strategic plan. We've changed some of our policies internally, but we know that's where it starts, is we have to be self-reflective about how we go about doing our business. And we've made sure to add an equity filter at every stage in our process. If we are developing a policy, we need to ask ourselves the question, how does this advance equity? If we are reviewing other policy proposals for potential inclusion on our support agenda, we need to ask ourselves, how does this advance equity? And in terms of specific policy interventions and areas of focus for us, we just this year launched our Food for All campaign. This is something that's been 2 or 3 years in the works, recognizing that if you're looking to identify gaps in service and in programs by population, the biggest, starkest one in our state is immigrant households that are completely left out of a program like CalFresh, have been largely, if not entirely, left out of all federal relief efforts. And in a cruel irony, are in large part the people who are producing our food and distributing our food. And so we have a lot of disasters and crises in our state, and this is the latest and greatest maybe with COVID. But every time that happens, there is a need for an emergency food intervention to help immigrants who are left out of federal policies and state policies that help people put food on the table when they need a little help. And so we started 2 years ago with a work group at the state level with immigrant rights partners, our local food banks, and the Department of Social Services, and what is now the Office of Equity at the state, but at the time was the Office of Immigration Affairs, to identify what are the real gaps and what are some potential solutions. And one of the recommendations that came out of that Food for All work group report, and I'm happy to share the report with you, was we have a program that provides state-funded nutrition benefits, just like CalFresh, to a small share of qualified immigrants. And those are immigrants who were eligible for federal SNAP, or CalFresh as it's known federally, prior to welfare reform in 1996. And that's a group of, right now, it serves about 40,000 households in the state. So the feds took away that eligibility, and California stepped up in 1999 and said, okay, if the feds aren't going to do what's right by these households, we will put up a parallel program that mirrors CalFresh in every way. The benefits are determined the same. It's just if you were eligible prior to 1996, but you aren't now, the state will pay for those benefits and to administer that program. And that's called the California Food Assistance Program. And one of the recommendations in that Food for All report was, why is this limited to just those qualified immigrants? Shouldn't it be available to everyone who would otherwise be eligible for CalFresh, but for their immigration status? And so that is state legislation that we are advancing this year. We're calling it our Food for All campaign. You may have heard about Health for All in your world, where we're doing the right thing, population by population, starting with those youngest kids this year, hoping to get health coverage, state-funded health coverage for older Californians who are ineligible. But let's do that for food as well. Food and nutrition are linked. I just had a meeting this morning with a staffer for a senator on the Human Services Committee, where that bill's headed next week for a hearing. And this is a member he's the vice chair. He's maybe not the most progressive member. And so we were able to make some arguments about health and nutrition. And I think this is something that probably resonates with this group, that access to good nutrition improves health outcomes and reduces healthcare costs. I was able to share a study with him from Benefits Data Trust from just a few years ago, showing that for seniors in particular, access to SNAP reduced emergency room visits and reduced healthcare costs by an average of $2,100 a year. And we calculated out, well, what's the average SNAP benefit for a household with a senior? Oh, that works out to $1,600 a year. So we were able to make sort of a fiscal argument to that person as well. And so as we seek to advance equity, I think that Food for All campaign is something that's really important to make this group aware of, if it's something that you may want to support. But we know that our work internally and externally is really, still in its early stages, and maybe is something that won't ever be done, right? It's always going to be a work in progress. But I did want to mention the Food for All campaign.
Awesome, that's great. I think that's really wonderful. I think the other thing that I've noticed, at least in my short time on the board at Nourish California, is that the organization also puts in a lot of effort towards language services for when they're doing outreach in the community, to make sure that all languages, or the most common languages in California, are supported, so that all of those voices can be heard and can be expressed in their primary language and preferred language. So I think that also really helps in terms of making sure that we're not trying to just collect data from the most easily accessed populations, but there's a lot of work that's being done to think about getting the true on the ground experience from Californians across the state. And that even though Nourish California sort of primarily is based in Northern California, there is a lot of effort to think about outreach across the entire state, and recognizing that one size doesn't meet all, and and it's really important to raise up the voices and the experiences of people all across the state.
Yeah, language access and translations are a huge issue with our nutrition programs, particularly for CalFresh. I mean, that's where I spend a good deal of my policy time, and both the sort of aggregate data in terms of who we're missing on that program that are eligible but not participating, and the qualitative data in terms of what we hear from clients and applicants is that even when the translations are available, they're often not that good. And so we're pushing at the state level for more real, like, user experience testing of those types of forms. That's a big component of SB 107 that will simplify the CalFresh application for older adults and people with disabilities, as it's actually written in the proposed statute that the department would have to test those new forms with older adults and people with disabilities across a range of languages to make sure that they do what they're intended to do, and that's simplify the experience and make it more user-friendly.
Absolutely. I think that's huge. So you started in your discussion of food for all, you made a reference to the health for all. And so I was wondering if we could transition briefly to talk about how Nourish California has engaged with either county health departments or health plans or health systems. Specifically, I know you talked about other grassroots organizations, but given that the fellows here are primarily healthcare providers, I'm curious if you can sort of talk about some of the outreach and engagement that you've done with some of these other more health oriented systems.
We love our doctors at Nourish California. Speaking of trusted messengers, and I saw credibility on one of Alana's slides earlier, and that is the name of the game. Right now, I'm working very closely with the LA County Medical Association and the LA County Department of Public Health. They're big supporters of SB 107. The next advocacy target there is the chair of the Senate Appropriations Committee, who's from LA, and we are planning an army of white coats on Zoom calls to call Senator Portantino and let him know the importance of SB 107. So we're really, this probably as engaged as I've ever been in my time at Nourish California with a medical provider on that front. And then they're reaching out to others to try to get that provider perspective, that again, emphasizing the link between nutrition and good health and all the important outcomes that flow from that in terms of everything from improved academic performance to improved earning potential over time, things that that decision makers do consider in terms of what makes good long-term policy. So there are those opportunities like that direct advocacy with a member. But we also partner a lot with physicians to do things like op-eds or letters to the editor. Again, that trusted messenger, we can partner and write the op-ed, but just having an MD or a health provider on that byline can be a big help when we're reaching out to members. We partner with providers on our board, Emma. I think we have more than one, and that's an important source as well to help us create those relationships. We have a lot more opportunities to do research and collect data through those relationships as well.
Awesome. Yeah, thanks for that. I'm curious too, in our last few moments together, if you can talk, it sounds like some of the county medical societies and the health department have helped sort of spread the word around specific legislation, but I'm wondering, are there sort of tangible ways for people, healthcare providers who have limited time, who want to engage in policy efforts or want to raise up issues like breastfeeding or medically tailored meals or some other sort of specific policy, even if there isn't sort of active bill? How do you recommend that those individuals and healthcare providers sort of get engaged, given time constraints and maybe the sort of legislative and administrative sort of agenda constraints?
Yeah, there are a lot of opportunities. There are those, I mentioned our advocacy with Senator Portantino. There are those inflection points in the legislative process where some targeted education and advocacy is really important. But member education happens year round. You never know when you're going to be able to break through with a member and create a real champion around nutrition and food access. And so maybe a bill isn't in front of the committee they chair that session, but in a future session, maybe they're end up being an author of a piece of legislation, or are able to speak to a colleague and help move those things forward. And that's at the state level. But we know at the state level, that's sort of that's where future Congress people are cultivated. That's where they come from. So you're also building a champion later at the federal level. So we just say, sort of get in where you fit in, do what you can do. If you can't write a letter of support or make a phone call, maybe you can, again, partner on an op-ed, or help connect with some data and research development that may be a compelling evidence base down the road for a fact sheet, or something that we then compare with a real life story in one of those legislative visits. But I will say those legislative visits are really impactful. And I know it was mentioned there's sometimes some concern, particularly with county health departments around lobbying. And we always want to assure people there's a few things to consider. Lobbying has a very specific definition, and it's about making an ask of someone with an active piece of legislation in front of them that they have some purview over. And the way we organize legislative visits is there's member education that happens, and then there's an ask. It's my job to make that ask. It's a community member or a provider who provides the educational context for why the problem is important and why it's important in that member's district. And then when it comes time to talk about the solution and what that member can do about it, that's my job. I just want to make sure that those roles are clear. There's a lot of, there's kind of a boogeyman out there about lobbying, and we often have to make sure people feel comfortable with that. And then as far as things like letters of support and phone calls, everyone here is also a private citizen. In your own time, and you should feel comfortable and free to make those actions as well.
Awesome. Yeah, I definitely learned that I'm writing in my own personal capacity, or I'm here in my personal capacity. You can say I can bring my expertise as a pediatric hospitalist who has experience in nutrition and sort of culinary medicine, so that you can add that credibility, but say I'm here in my personal role as a citizen, as you said, as opposed to in my sort of formal job role. Yeah. Well, Jared, thank you so much. This was super helpful. I think it would be great if we could share the Food for All report and the 1-year anniversary post. So whether you send that directly to Alana or can send it to me, I'm happy to share it. But thank you all so much. I think I just want to say, if anyone else has any other questions or wants to use me as a resource, please feel free to reach out. Alana has my contact information. You know, Jared, I'm not sure if you want to list ways for people to get on the Nourish California sort of bill.
I'll share that along with the other resources. And we provide timely calls to action when people can weigh in, and we make it easy. That's a big part of what we try to do.
And I can attest to that. It is very easy. There's templates, there's timelines, there's scripts, all